Like most other cancers, bone cancers are also unpreventable and unpredictable. Limb salvage surgery is something which is gaining a lot of popularity. Fully functional limb, which earlier would have been treated by an amputation or would have been untreatable. Hi everyone, today is National Cancer Awareness Day and I'm here to speak to you about bone cancers. So bone cancers are of basic two types. One are called the benign bone cancers, in which this cancer does not spread to the rest of the body, and second is called the malignant type of bone cancers, in which this cancer can spread to the rest of the body also. Like most other cancers, bone cancers are also unpreventable and unpredictable, but early detection and treatment can save a lot of lives and limb. Limb salvage surgery is something which is gaining a lot of popularity, in which the cancerous part of the bone is removed and replaced by what is called a megaprosthesis, which mimics the joint, giving the patient a cancer-free, fully functional limb, which earlier would have been treated by an amputation or would have been untreatable. Now, who needs bone cancer screening? All patients suffering unexplained bone pain with common conditions ruled out, like vitamin D deficiencies and others, will require screening for bone cancer. Patients having family history of bone cancer should be screened for bone cancer, and patients who are suffering from pathological fractures, that is fractures occurring without a trauma or with minimal trauma, can also be suffering from bone cancer. How do you screen for a bone cancer? So the most important investigation, or the most basic investigation which will lead us to the diagnosis of a bone cancer, is called the X-ray. In certain conditions, the doctor might require an MRI, a CT scan or a PET scan. The confirmatory test for a bone cancer is called a biopsy, in which a needle is put into the bone, tissue of the bone is taken out and then sent for histopathological examination or examination under a microscope. When should you screen for bone cancers? So depending on the age group, a few cancers are more prone to occur in younger age groups, like Ewing sarcoma in youngers, as well as multiple myeloma in older patients is more common. So depending on what stage in life you are in, you are more prone to certain bone cancers as opposed to others. Any swelling or pain which is bony in nature should also be examined. And I hope on this National Cancer Awareness Day, this video enlightens you about bone cancers, its treatment options and its investigations. If you find it useful, please share. Thank you.